Prince George County and Maryland residents showed up in thousands today at Prince George Community College to thank President Biden and Vice President Kamala Harris for lowering prescription drug prices, expanding access to affordable healthcare for many Americans, and as well as improving the quality of life for seniors and retirees. The crowd that gathered here today at the community college were enthusiastic, roaring when the president and the vice president came out, including elected officials that came in today just to thank the president for everything that he has done in the past 3.5 years. From pulling the country out of a global pandemic when the economic was in ruts and setting it right now on the path. As we know, the U.S. is in all the advanced economy, the U.S. economic is the only one that has recovered fully. This event also come at a very unique period where yesterday, this week, the report just came out regarding inflation, that the U.S. inflation, the inflation is dropping below 3%. The first time since the first time to that level since the president took office. So this event, as the president said, a lot of what the policy that he has put in place might take time. And this is just a sign of what he has done and how he has moved the country and set the country on a better path forward. I was able to speak with some of the attendees here at the event. Some of them were seniors, and some of them are benefiting from the policies that the presidents have put in place, including making insulin available, affordable at $35 each, including as well as other drug prices. Today, the president announced that the 10 initial drugs that were negotiated under the Medicare drug plan program is now set and will take effect in 2026, and next year in 2025, starting in January, all seniors on Medicare only have to pay $2,000 out of pocket fee, nothing more. So this significantly has one attention. It is between deciding whether to buy grocery or buy prescription drug. So it has significantly improved our quality of life as well as our husband to be able to enjoy the time. I've worked for over 30-40 years to be able to enjoy this time with each other to travel the world.
Their commitment to healthcare and lowering prescription drug costs is extremely important to me because I'm currently on a medication that has been very difficult for me to obtain. But fortunately, I'm covered. But there are so many people who fight every day trying to cover this medication that can cost $1,300 a month out of pocket. So I think that just bringing their policies in to help master through or negotiate through big pharma and just get a handle on this, because it's really been difficult for a lot of people, diabetics and those who are on. My husband is on medication for multiple sclerosis, so those medications are very costly. So it's only in our country that we tend to have this issue. So I'm very fond of and look forward to what they're going to bring to that through their policies on this.
The president, the announcement that was made today is part of the Inflation Reduction Act that the president signed 2 years ago, which the Democrats voted for, and the vice president was the tiebreaker to allow the that allowed the bill to be passed and for the president to sign the bill in place. This is the event today is the first joint event that the president and the vice president appeared together since the president last month ended his candidacy for a second term and endorsed Vice President Kamala Harris. As I said, these events come at a significant period because next week the DNC in Chicago, where the candidate Vice President Kamala Harris and our running mate Tim Watts will be presented, their ticket officially presented. Here are what some of the attendees have to say.
That's right. So first of all, let me just start this.
Yes, I'm here to represent. I am delighted, I am elated that we now have a candidate we can all get behind. We love Kamala Harris and we know that she's going to be a phenomenal president.
Okay.
She has my full support.
He has your full support.
Absolutely.
Look.
I see you have the Kamala Harris ad.
Hey, for 2 weeks.
So let me ask you, the event that's taking place today is lowering prescription drug.
I'm sorry?
The event that is taking place today is regarding lowering prescription drug price. How does that impact you? If you can talk about
Well,
that.
I'm a senior citizen and I'm on a fixed income. I'm retired, so of course, costs are a concern to me. And being a senior citizen, I do have certain medical conditions and prescriptions, so it's very important to me.
And regarding what the administration has done in terms of improving quality of life, improving investment in the black and brown community. Can you talk about how that also impacts you?
Yes, well, it's going to impact me in every way because it's going to impact the cost of food, the cost of living, the cost of transportation. All of that is a part of it, and so I believe in her policies to reduce costs for especially the middle income, because I am part of the middle income and we are most impacted and affected.
How?
Again, because many of us have retired, we're on fixed incomes, and costs continue to soar. And so naturally, if she would, whatever she could do to maintain and lower those costs would help us to have more enriched and a better life.
How do you see what she and the President Biden and her, what they have done in the last 3 years? How will what is your view regarding what the policy that the Biden-Harris administration have put forth and the progress that they've made?
Well, actually, I recognize the fact, number one, they inherited a very negative situation. They had to undo a lot of the damage that's been done. It's been a process, so they weren't able to just come in and aggressively approach their own agendas because they had to undo certain things that had been done in the past, which have affected us. Of course, they inherited the situation with the border. That was a big problem, and they have been consistent.
Any steps that help seniors at lower income afford prescriptions, necessary prescriptions. Talk about it? Necessary prescriptions is much appreciated. It's a significant cost, especially as you get older. And, any help we can get is much appreciated. I realize scientific research is expensive, but we're in a modern society and we should be able to adjust so that, we can afford medication.
I had the chance ahead of this event to talk to the administrator of Center for Medicare and Medicaid, about why the significance of today's event, and she told me that that the administration will continue to negotiate on drug prices, and there are the next group of drugs that they will negotiate on are 15 drugs that they are working on, and she also told me that the administration will continue to monitor. As we know, there are times where doctors will swap or pharmacy will swap prescription, and so she said she will continue to monitor. Our office and the administration will continue to ensure to monitor for any loophole that where doctor might swipe out of the 10 drugs that would negotiated to a different drug.
Other people benefit not from this law, but from additional laws. So the Affordable Care Act ensures that people receive access to health insurance coverage. Medicaid also provides coverage. It's true, though, and important that we continue to work to make sure that healthcare and prescription drug costs are affordable for everyone, and that's what the president and the vice president are very focused on.
Okay. Thank you. But I asked that question obviously because not everyone is on Medicare, and I know this is something that the administration also have been working on to expand it through private insurance company. So that's why I asked that question first. There are people that are not currently on Medicare, but are also facing the high cost of prescription drug prices. Like, what other option do you have for them? If you can this is something that the president has been working on for a while before he came into office. If I understand very well yesterday, that the announcement also will include a cap of $2,000 starting from next year. Am I correct?
There is a $2,000 cap next year for everybody who has Medicare prescription drug coverage.
Okay, so additional drug will be added to this program. Could you talk about what those drugs are and how you're working the ongoing negotiation on those drugs as well?
We worked so the first year we selected 10.
Mm-hmm.
We will now select 15 drugs for the next round of negotiation. Those drugs.
Additional 15?
An additional 15.
Okay. Do you have an idea what those drugs will be, or is still under consideration?
We will be looking at the drugs that are the next top spenders in the Medicare program. So for the first 10, we looked at the most expensive and the most frequently used drugs in the Medicare program, and then we will now look at the next most frequently used and or most expensive drugs, and those will be the 15. And we're in the process of getting the data, and then we'll release those that information when it is ready.
Are you concerned about some of these drugs that you've already lowered the cost for through Medicare, that doctors might prescribe? They might find other loophole to prescribe higher drugs that are more expensive?
We will definitely be monitoring to make sure that people have access to the drugs that we have negotiated. And of course, doctors, if they want to make changes because of clinical reasons, that should happen, and those are decisions that should be between the doctor and the person. But in terms of making sure that the health plans ensure access, we will be monitoring that to make sure that they're doing what they're supposed to be doing.
Okay. Thank you very much for your time. Thank you.
Listen, I'm ready. Y'all ready? I can tell you right now, we got a couple folks who back here. In a few minutes, you're going to hear from not just the 46th President of the United States, Joe Biden. You're also about to hear from the 47th President. Feels good, don't it? It is great to be here. It is great to be here in Prince George's. It is great to be here at Prince George's Community College. Some of the most amazing leaders in our state. This is where they are bred. This is where they are trained. And this is where they will continue to lead the state and this country. Prince George's Community College. And I gotta tell you, it also feels good to be here, particularly for the kind of announcement that we're about to make. 48, we love you! Listen, listen, y'all need to hold on because we trying to bring the president and vice president out here, y'all. But I'm being serious. I'm being serious when I say how important it is to be here, particularly for the kind of announcement that we're about to make. Because as we've seen, elections have consequences. And the reason that we are about to hear the kind of announcements and the kind of work that have happened is because 4 years ago, we elected Joe Biden and Kamala Harris to be the leaders. And it means a lot being here because what people might not know, I was born less than 20 miles away from where we stand right now. And some of my earliest memories were right in these areas. And some of my most traumatic memories. Because when I was just 3 years old, I watched my father die in front of me because he didn't get the health care that he needed. I don't come from a family that's used to making policies. I come from a family that's used to suffering the consequences of it. And so to be here in this moment, I'm here to say that this moment right now, this is personal. And it's exciting to know that we have an administration who sees us and who fights for us. Because my father had a rare but a treatable virus. But when he went to the hospital, his clothes were disheveled and his face was unshaven. And when my mother showed up at the hospital, they asked my mother questions like, is your husband prone to exaggeration? And he was released from the hospital with the instructions to go home and get some rest. And hours after they released him, he died in front of him. So understanding that we have an obligation to make sure that our healthcare system never overlooks any of us. us here today, we have been shaped by a brokenness of a healthcare system. That we know that we have fundamental work to do because in many cases, the issues that we are discussing, these are not academic. We do not need white papers to explain it because we have grown up in it. So today is an important moment because this is what we know. Today is a chance for us to go from being unseen and untreated, for so many people to not have an opportunity to have basic insurance and know that basic insurance is something that is affordable. Today is a day to know that because of the remarkable leadership of President Biden and Vice President Harris, that this country continues to move forward, and we can and we will be a country that sees all of us and not just some of us. Because what this administration is doing, this administration is saying, we are not just going to pave over the cracks, we're going to fix the infrastructure. This is an administration that has both protected our basic rights and made sure that our basic rights are affordable. And that's what today is all about. That today we join in partnership to announce new efforts to make prescription drugs more affordable through the Inflation Reduction Act, which this administration got done.
So Judy, we thank you so very much for being here. I want to recognize the incredible Governor Westmore. And Wes, I'm so thankful to you for all that you do in service to our nation in so many different ways, and your friendship, and in particular, to share such a personal story as you have, and I know it takes a lot out of you to share that story, but to do it in a way that is about lifting up other people and helping, hopefully, others who are not in this room, understanding how real people are impacted every day by the system. I want to recognize the people of our administration, including Secretary Becerra, who is here. The Gold Administrator, Brooks Lasur. My dear friend and former colleague, Senator Ben Cardin. Representative Barragan, the chair of the Congressional Hispanic Caucus. And Representative Anfunes for all of you. And I want to recognize your next United States Senator, over the years, I'm telling you, Marilyn, you're going to do a great thing when you send her to the United States Senate. And of course, I could speak all afternoon about the person that I am standing on the stage on so many issues, including to expand access to affordable health care. And today we take the next step. Thank you, Joe. Forward in our party. Thank you, Joe. 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 We believe deeply every senior in our nation should be able to live with security, stability, and dignity. And so in the United States of America, no senior should have to choose between either filling their prescription or paying their rent. That's the subject of today. Because we know for far too long, far too many of our seniors have struggled to afford their medication. And as a result, seniors have been forced to spend their time trying to figure out how they are going to be able to fill a prescription like insulin based on the doctor's prescription, which is about saving their life, or whether they have to ration their pills to be able to make it stretch through a month. And why, we all know, but let's ask, why are prescription drugs so expensive? I will tell you. Well, one big reason is for years, Big Pharma has often inflated the price of life-saving medications. Often charging many times what it would cost to make just to increase their profits. And millions of Americans have suffered as a result. My entire career, I have worked to hold bad actors accountable and lower the cost of prescription drugs. As Attorney General of California, I took on pharmaceutical companies for deceptive marketing and illegally inflating the cost of drugs. And we won billions of dollars. And this is to the benefit of not only tens of millions of people on Medicare, but also millions of Americans on Medicare who have long-term disabilities. And understand, as a result of our negotiations, the government will also pay less than for prescription drugs. And think about what that means in terms of helping taxpayers save money, whether or not they take these medications. So all of this is to say, 2 years ago as Vice President, I was proud to cast the tie-breaking vote that gave Medicare the power to negotiate and let it get to the president's desk. And I was proud when our President Joe Biden signed that bill into law. In the 2 years since, we've been using this new power to lower the price of life-saving medications, and now to announce the result of those negotiations. It is my eternal, great, great, great honor, I have to tell you, to serve with this most extraordinary human being and American, and being our president, Joe Biden.
Thank you, Kamala. I've been waiting for this moment for a long, long time. First time I sponsored a bill that Medicare negotiate the price of drugs was in 1973 as a professional senator. A guy named Frank Church, state of Idaho. Folks, I have an incredible partner. Progress we made. She can make one hell of a president. Judy, thank you for sharing your story. It's really one. It's hard to the Americans. People like my dad used to lay in bed at night when they lost his insurance as the company he worked for, staring at the ceiling. Literally, and you've all experienced it, you know people have experienced it. Wondering, what in God's name happened if my wife gets breast cancer? If I get sick? If my children get seriously ill? What happens? What in God's name, how can we pay for the drugs, prescription drugs? I'm serious, these are the discussions. You know it. Do we have enough insurance? Can we afford the medical bills? We'll have to sell the house and get a second mortgage. 30 discussions that took place in my house and your house. Kamala and I both get it. You know it isn't just about health care, it's about your dignity.